The chair now recognizes the ranking member of the full committee, Mr. Larson, for 5 minutes.
Thank you, Mr. Chair. Mr. Chair, I'm going to yield my time to Mr. Johnson of Georgia.
I thank the ranking member of the full committee, and I want to thank Chairman Garrett and also Ranking Member Cohen for convening this important hearing. I also extend my gratitude to the gentleman on the panel for your very wise testimony today. One of my proudest moments of the 118th Congress was the passage of the bipartisan, bicameral Federal Aviation Administration Reauthorization Act of 2024. This monumental achievement reaffirms the United States as a global leader in the aviation industry. This is just the beginning. Our task now is to ensure that the policies we've fought for are executed with urgency and precision. The stakes are too high because more than 20,000 airports and over 1 million aviation workers across the United States depend on us. Airports like Hartsfield-Jackson, Atlanta International Airport in Georgia, one of the busiest in the country, are waiting for these changes to enhance safety, efficiency, and the passenger experience for millions every day. We owe it to every worker in this industry and every passenger flying our skies to ensure that these reforms are not just promised, but delivered. I'm proud to have worked on this law, and I look forward to collaborating with my colleagues, stakeholders, and the entire aviation community to ensure its successful implementation. Mr. Terrari, the 2024 FAA Reauthorization Act directs the FAA and the Department of Energy to lead research and development for the safe use of hydrogen in civil aviation. This involves creating a strategy for hydrogen-powered aircraft, developing certification standards, and coordinating with various stakeholders. The goal is to ensure general aviation aircraft can transition away from leaded fuels by 2030. How can airports collaborate with the FAA in shaping these standards to ensure smooth implementation of hydrogen propulsion in aviation?
Thank you for the question. From an airport perspective, I think the question could probably be answered better by a colleague on the over general aviation, but real briefly from the airport perspective, once it is certified, once it is allowed in aircraft, that's when the airport would have to deal with storing it at the airport or having it on site. But other than the implementation certification, that's not something that the airport would really be involved in.
All right, thank you. Mr. Bunce, would you care to respond?
Yes, sir. One of our advanced air mobility companies have just demonstrated using liquid hydrogen, which you have to cool. You know, it comes in a liquid form, but they put basically a pod underneath the vehicle, and they extended the range tremendously. Now, we don't have the infrastructure to deliver that to all the airports, but virtually all of our companies are looking at the potential for hydrogen, whether you go and you convert that hydrogen through a fuel cell to electricity to operate electric motors, or you actually burn that hydrogen up at altitude like you would a petroleum-based fuel. So there is tremendous potential there. There's also a lot of technical challenges of being able to cool it to a level that you can keep it in that liquid form because it boils off. So, but we've done it before, and we're very excited about the potential of the technology.
Thank you. Mr. Reagan, mental health is often stigmatized in high-stress professions like aviation. The 2024 FAA Reauthorization Act acknowledges the importance of mental health, mandating the FAA to update its aeromedical protocols and establish a mental health task group to support aviation professionals. What steps do you think the FAA and aviation companies should take to reduce the stigma and encourage aviation workers to seek mental health support without fear of judgment or negative repercussions?
I appreciate the question. I think it starts really with ensuring that we treat it like an illness, like we do with any other condition that a pilot or a flight attendant or an air traffic controller would face. We need to be able to ensure that workers don't have to worry about losing their jobs, losing their pay, losing their livelihoods and careers because they're suffering from an illness. And that right there, that assurance that they're going to be able to seek treatment and move on with their lives and continue their careers it's a really important component. Otherwise, if you've got that hanging over your head that you might have to find a new line of work if I seek the treatment that I know I need, you're not going to be able to get the right types of treatment for the people who need it moving forward.
Thank you, and I yield back.